I've had a number of different roles in physiotherapy that have led me to where I am today. I had always wanted to be a health professional, and I was really fortunate to study physiotherapy at AUT in New Zealand. I really loved musculoskeletal practice. I really liked working one-on-one with people who had pain or injury, and I felt that was a really rewarding area for me. So I went straight into that area as a new graduate, and I've stayed in that area ever since. Really early in my career too, I was really fortunate to become a clinical educator. So I hosted students in my practice, and I was able to share that journey with them to become physiotherapists themselves. My love for teaching led me here to the University of Queensland over a decade ago, where I undertook a PhD in physiotherapy education. I continue research in this space, and I still guide students on their journey to becoming musculoskeletal clinicians. My number one goal as a lecturer is for students to complete my courses and our program feeling really confident about the skills that they have and the values that they can provide to those that are within their care. Our health profession, like all health professions, is changing really, really rapidly. So I think we really need to think about how we can support our newest members of the profession to be really confident about who they are and the values that they have for physiotherapy. I think if we can focus on confidence as a construct, we'll have more physiotherapists staying in the profession. I think we'll have physiotherapists moving into new and emerging areas of practice. And I think we'll see more physiotherapists becoming leaders in healthcare. A lot of my research now looks at the experiences that our students have when they go through that transition from student into the workforce. What's been really interesting about this research is hearing about new graduates' real diversity of settings that they're going out into in the workforce. We hear from new graduates that in a typical work week, they might work across a residential aged care facility, a hospital and a private practice, all in the same work week. And this is really exciting because it allows them to develop a whole new set of skills, and it allows them to work with people from different backgrounds. But also with this comes a lot of stress. So we hear from new graduates about the importance of having a lot of responsive workplace support and having really high quality and individualised mentorship to really help them in this transition. I really love my role with the Australian Physiotherapy Council, both as an accreditation panel member and also on the accreditation committee. I'm really driven by innovation, so it's so exciting to see the amount of innovation that's going on in physiotherapy training across Australia. What I've seen in my accreditation work over the last 10 years is that increased participation from the private sector. We've actually undertaken research in this area to find out why private practices want to host students and what are the strategies that they use to integrate students into their services. And we've found some really exciting things. We hear from private practices that they really love taking students. They like being involved in teaching, they like assisting the student on their learning journey, and they see real benefits for their staff as well, to keep their staff engaged in a range of different activities during their workday. It's really important that we partner with employers for them to understand the needs of new graduates from a workplace perspective and also a mentoring perspective. I'm really, really passionate about our physiotherapy profession, and I'm really passionate about us keeping physiotherapists within our profession as well. There are a number of ways we can do this, and we know from the research that there are some ways that we can really make sure physiotherapists are thriving in their careers. And one of the ways we can do this is making sure that we're working in new and different and emerging spaces, and we have a lot of variability in our day-to-day roles. I believe it's really important that we have strong partnership between our professional bodies, our universities and our employers to really smooth that transition from student to clinician, to really support the newest members of our profession.